So my talk in general is going to be about breast health and breast care, why you should care and what you should be doing. Well, first off, why should you care about breast care? And what should you know about your own breast health? Well, your breasts do change, as many of you probably know, throughout life, as well as during your younger years throughout monthly cycles. You should actually be examining your breasts. Most of us say about once a month. And again, your breasts change in response to hormones, sometimes cyclical, sometimes not. It can actually vary with your diet. And then breast anatomy. So the important things to know are that your breasts aren't just made up of one type of tissue. Your breasts are made up of not only the lobules that eventually can produce milk when you're pregnant, but they're made of ducts, which carry the milk to the nipples. And then they're made up of connective tissue or stroma, as well as fat. So screening for breast cancer. The most important thing about screening is that screening doesn't prevent the development of breast cancer. So screening is to detect breast cancers when they're small, hopefully before you feel them, before your physician feels them. The smaller they are when we find them, the easier they are to treat. And again, screening mammogram reduces the risk of death in women diagnosed with breast cancer. And what are some common breast complaints? Masses and lumps, sometimes pain, sometimes redness, changes in the breast, and nipple discharge. These are some of the most common things. The first step in evaluation is often an exam by your primary care physician or your gynecologist. Following an exam, oftentimes they'll send you for additional testing. So on a diagnostic exam, oftentimes they'll do not only the two mammogram views that you get with your screening, but you may get additional views. It may include an ultrasound, and oftentimes it'll involve the radiologist coming and talking to you at the time. So what's the problem now? So now we found an area that looks abnormal, and now someone says you need a biopsy. How do we do these biopsies? Most commonly, either the radiologist or your breast surgeon will do them in the office. And ideally, we do something called a core needle biopsy, where we can actually take a piece of whatever this lesion is with a little numbing medicine first and hopefully make you as comfortable as possible. The other thing we can do if we think we're seeing a cyst or something that has fluid in is put a very small little needle in and draw the fluid off. Sometimes the lesion goes completely away, the lump goes away, and at that point we're all very happy and we breathe a big sigh of relief. Good thing to know, if you do have a lump, the majority of biopsies don't show a cancer. So only 1 out of somewhere around 4 to 5 biopsies will actually show cancer. And how common truly is breast cancer? Well, it's the second most common cause of cancer in women, the first being skin cancers. 1 out of every 8 women in the U.S. will be diagnosed with breast cancer during her lifetime. So it's very common. How do we treat it? It depends. Treatment can include any or all of surgery, radiation, and then systemic therapy for the whole body.